Good evening, everyone. I am Dr. Harita Nath, member FCPI. Welcome you all to the fourth basic module of Research and Publication Forum on the topic How to Write a Review Article by Dr. Raja Amartyasri. As researchers and healthcare professionals, we understand the significance of review article in synthesizing evidence, identifying knowledge, and informing practice. However, writing an effective review article requires careful planning, critical thinking, and clear communication. Today, I am honored to invite Dr. Amartya Shri to take us through this enlightening session, unveiling the complexities in writing a review article. She has a very vast research experience, mainly in the thrust areas such as infectious disease, rational use of antibiotics, clinical research, pharmacokinetics, etc. Her commitment to public health awareness is impressive and have participated in numerous volunteering activities and undergone training in various hospitals. She has completed many certification programs like ISCR, Clinical Research Coordination Training Program, New E6 GCP, ICN GCP, NIDA, etc. Her awards and recognition include Star Performer at AIG Hospital, second prize in JM sessions during Antimicrobial Resistance Awareness Week, and recognized for awareness improving initiatives on abuse deterrent formulations. Amartya is a valued member of prestigious professional organizations, including Cochrane, FCPI, ASCPT, and APUA. She also attended many conferences, workshops, and have presented many research papers. With this brief introduction, I would like to invite Dr. Amartya Sri to begin with the session. Over to you, Amartya.
A very good evening, everybody. Thank you, Harita, for the kind introduction. So let's begin our today's session with a question. That is, for an instance, you have to learn about a new drug that has come up in the market. So you want to learn about and understand the drug doses. You want to understand the PKPD, the ADRs, the mechanism, the structure, and everything about the drug. So there exists a lot of literature and evidence surrounding the drug, like the in vitro data, the preclinical studies, the PKPD studies, and the phase 1, 2, 3 studies. So in this scenario, what would you refer? What resources would you choose to refer to and learn about that particular drug or any research topic indeed? So if you ask me, I would choose reading a very good review article. So why a review article? So review articles are at the top of the evidence pyramid in the medical research, where they summarize the existing literature, and also they bring out the uh, gaps that are existing in the literature and provide us the new novel ideas to conduct research. So review articles, in just let me put it this way, is the cheat sheet to the state of clinical research in that particular area or the field. So who can write the review articles? Generally we see experts in the field and also the professors who write review articles, who write their opinions, who write narrative reviews, who conduct systematic reviews, which help us frame the guidelines and which are highly cited, which will optimize the patient care. So who else can also write review articles? Anybody who are interested can write review articles. Anybody who wants to contribute to the scientific community can write review articles. So today, let us learn how to write a review article. And so the major objectives for today's session will be to learn and understand what a review is and how the review is different from original research, and what is the purpose of writing a review article and conducting a review research, and what are the types of reviewers, and the various steps of writing a review research, especially focusing on the narrative review, which is a type of traditional review, and also how to utilize the standard checklist and what is standard checklist. So review research and the review article writing is investigation that is carried out around the original articles that exist, which helps us to critically analyze and synthesize the conclusions based upon the key evidences. It helps researchers to evaluate the existing literature and also summarize the existing evidence. So let's just put this way. For example, you take a drug that is approved in 2020 and you are trying to do a literature review and write a review article about, for example, what novel can be done with that new drug. So a review article will start in the history and it will pay path into the future. That is, you start about the drug being approved in, for example, 2020, and you summarize the evidence around the drug until today and identify the gaps and provide new ideas to conduct research in the future. So the review article will begin in the history, will summarize everything that is present now, and will identify the gaps and provide us the new research ideas. Let's try to understand the difference between a review research and writing a review article, and what is original research and how do you write an original research article. So let me just give you an example. Let's take a hypothesis of drug-induced nephrotoxicity. Okay, so when you are trying to do a review research or a review article, you will go to different databases and you will utilize search terms like nephrotoxicity, drug induced, and then you will identify the different research articles like RCTs, observational studies, case reports, and all of those, and you will evaluate them, analyze the existing data, and you will summarize the existing data. That is, you will write and then you will identify what are the gaps and you will give the ideas for new researchers to how to conduct research in that particular area. Whereas in original research, you will select a population, you will either give the drug, you will conduct an interventional study, and you will collect the data from the patient population. You will analyze that data, you will uh, conclude the results, and you will compare your study details with the existing studies. That is how review research and original research are different. Original research will be conducted in population from a sample. So what is the purpose of review article writing? What is the purpose of conducting review research? So as highlighted before, it summarizes the existing literature. So for example, another example like a drug related or some disease related, you want the evidence. There will be multiple individual studies, each talking about different thing, each giving you a different conclusion. So how will you understand the whole thing? Then review article comes into a play where it will provide you a snapshot of all the existing literature. So it is a great tool that summarizes the existing literature, and identifying the gaps is the major purpose of review article, because it provides the new researchers novel ideas. When you are trying to conduct a research, you have to do a thorough literature review, and review articles have already done it. So when you look at a review article, it will provide you new research ideas and the gaps. So new researchers can start with reading a review article, which will give them new ideas. And it will also critically analyze and evaluate the existing studies. That is, it will identify the strengths, weaknesses, the limitations of the conducted studies. For example, certain review articles, they will talk about the sample size being small or the lack of long-term outcomes to conclude that one drug is better than the other drug, or one drug is inferior over the other. So review article not just summarizes the existing literature, beyond summarizing, it will go to critically analyze and evaluate the data. Review articles are not just a tool that is utilized or a research resource for researchers, but it is also very important for informed decision making to the clinicians, because clinicians who practice evidence-based medicines on day-to-day lives, they require review articles. They are a great tool to educate the readers and especially to the students. And also writing a review article will help improve your profile, expert profile, since you're contributing to the scientific community. So let's just take this example of lenacapavir, which is the long-acting antiretroviral drug. So in this is a recently published review article. So in this review article, they are saying that the purpose of the review article is to provide knowledge and understanding of unique pharmacological properties of this drug, which not only helps the clinicians but also the researchers to navigate in this area, that is HIV treatment. So the purposes of the review article will differ from one review article to the other. What are the major, based on the objectives, the review articles are of 4 types. That is status quo review, history review, theory or model review, and issue review. In the status quo review, the current research that is being conducted in a given topic or a field will be presented in this type of reviews. Whereas in the history review, the development of a research in a field over a period of time will be objectively evaluated. Whereas in the theory or the model review, there will introduction to a new theory or a model will be given. In an issue review, a specific issue or a disagreement or a question that is hypothesized will be investigated further. So these are the 4 major types of objectives for conducting a review. So let's just meet the review family. There are 7 review families. So one is the traditional review, and the systematic review, review of review, rapid review, qualitative review, mixed, and the purpose review. These are the different kinds of reviews. Let's just try to understand each and every type of review family, first of all. So the traditional reviews, these are the reviews that follow a bibliographic approach of search. The type of literature and the time period will be dependent on the reviewers. So the types of reviews that come into the traditional reviews are the state of art reviews, critical reviews, and narrative reviews. Whereas the commonly seen, the systematic reviews, they follow a comprehensive approach. They have a defined guidelines to follow. The widely known PRISMA guidelines that help the researchers to conduct a systematic review. They also include gray literature in their review. That is the common policies. All of these are considered the gray literature. So they are also included in the systematic review, other than the published articles in the journals and books and all of those. So what is the review of review? Review of review generally focuses on the existing reviews and it only focuses on a particular type of review. For example, a review of systematic reviews or a review of narrative reviews. So in this, when they are searching, they search in the databases like where the systematic reviews are available. For example, on the Cochrane databases, they search and they conduct the review of review. Whereas in the rapid review is time bound. Here, the reviews are conducted to deliver a specific review in a specific period of time. So the search is limited to only a specific type of study or only a specific language or that kind. Whereas in qualitative review, as the name suggests, the qualitative studies that are conducted will be included in this type of qualitative systematic reviews. The mixed reviews is an integrated or integration of both qualitative and quantitative review. Whereas the purpose specific reviews, it is only abided to the purpose, that is during the research purpose of the research that is conducted, types of studies, and the samples to be included. Everything will be done according to the purpose of the review. So the common types of reviews that are conducted are traditional reviews and the systematic reviews. As in the upcoming basic module, you will learn about the systematic review. Let's today focus on the traditional reviews, that is emphasizing on narrative review. So what are the steps of writing a review? So these are the basic steps of writing a review article. Let's just get into each one at one time. So identifying the research question is the utmost. Identifying your hypothesis is very important when you're trying to do a review. So focused and flexibility is the one of the characteristics of a review question. So what does that mean for a research question should be focused and also being flexible? For example, you take this review question or a hypothesis of drug-induced cytopenias. This is a very broad hypothesis. When you can focus it onto something like drug-induced or antibiotic-induced or beta-lactam-induced cytopenias in pediatrics, you have narrowed down your search strategy and your hypothesis into something called a drug that is beta-lactam and the population that is pediatrics. But also it is flexible that you can include different dosage forms and different beta lactams. So your research question should be not too broad and neither too narrow. It has to be focused and should be flexible. What does that mean? That research question has to be answerable with the existing literature. So for example, you want to do a review research regarding therapeutic drug monitoring in India. So this research question might not be answerable right now because therapeutic drug monitoring is not available in most of the hospitals in India, and also clinical pharmacists. And also if you want to do a research question, review research on role of clinical pharmacists in therapeutic drug monitoring in India, it again narrows down your uh, research question, and also it cannot be answerable because the existing literature is small. So your research question should be such that it there should be data existing so that you can review and identify the gaps, and it should lead to a synthesis. Means the existing literature should be in such a way that it can be comprehensively and critically evaluated, and it should give you new clinical findings, and it should help you identify the gaps and find the novel ideas. And also the review question should be appropriate for the review type. You cannot do a qualitative review. For example, you are trying to compare the dosage form of or the doses of two drugs, and you cannot do it in a narrative review. You can use a systematic review or a meta analysis. So your review question should be appropriate to the type of review that you want to conduct. So these are the basic characteristics of a review question. After you frame the review question, then the next step would be to collaborate with different people, to people from different experiences and different expertise who will help you to conduct the review research smoothly. Basically, collaboration is the key. It will help you bring different perspectives of different people and also critically evaluate the research. It will minimize the bias, and it will also help you to broaden your network, access different resources, and it will remove the burden from you because there is division of labor between different collaborators, different researchers, and it will also enhance the accountability, and it will provide you motivation to conduct review research. Because when there is collaboration and when there is a team, things can be done easily. So collaboration can be done, and it is the key to conducting a good review research. And then we come to doing a review, literature review. So where to do literature review, how, what search terms to use, how do we apply filters and all of these. So the databases that we can utilize to conduct review are PubMed, Embase, Cochrane, and Google Scholar. And these are the widely used databases that can be used to do literature search. And also, the search term should be appropriate. The Boolean operators and, or, and not are very useful. When you use and, you are utilizing two terms together. For example, you take beta lactam and allergy. So when you put and in the middle, all the studies and all the research articles related to both these words will appear in your search. Whereas when you use or, either of those will come. Any research article that has beta lactam word or any research article that has the term allergy will appear. So it will broaden your search strategy. It will broaden the number of research articles that will available to you. And not, so when you use beta lactam not allergy, then you will get the terms that have only the research articles that have the term beta-lactam only. So this is how you should effectively use the Boolean operators when you're conducting the search, and also applying filters. So you should look for text availability, that is either you require full text or you require abstract. In that way you can filter. And also the article type, either you are looking for a clinical trial, systematic review, or an other review, or else an RCT or anything. You can choose the article type and you can filter out. For example, when we are conducting a review of review, then we can choose the article type as review, and we can eliminate or exclude all the other type of research articles. It will make our literature review quicker. And also the publication date. So the publication dates, we will see 1 year, 5 years from today. So we will also be able to filter out the older research articles. And additional filters include age and the species in which the research is conducted. So all of these can also be utilized to effectively conduct literature review. So the next step after we conduct literature review is to start writing the review article after analyzing the uh, research articles. So first is to choose a title. So the title must be informative. It has to bring people. It should cause enthusiasm. It should be interesting, and it should be rational, and it should reflect your study objectives, and it should avoid the unnecessary words and abbreviations. So this type of review that you are conducting should also be included in the title of the review article. So it is most important sentence of your review article which brings you the audience, and it will also help you to give a good title. So choosing a title is very important step in writing a review article. Then comes the abstract. So abstracts can either be constructed or in deconstructed way, whether you go like introduction, methods, discussion, conclusion, in that format, or you can just write it in a small paragraph including all the details, the main eligibility criteria, the results, and the objective and the hypothesis that you have used. All of this should be written in the abstract. And then comes the keywords. Writing keywords is the key. Basically, keywords will help you get more citations. They make your article more visible in the research area or in your field. They help you capture the essence of your paper. And the most important thing is, it is highly recommended that you don't duplicate your words from the title in the keywords. So writing introduction. After you are done with doing the literature review, writing the abstract, deciding on your title, and identifying your keywords, you should start writing your introduction. So in introduction, the easiest way to write introduction is utilizing the funnel approach. So this funnel approach is where you start with a broad concept, that is foundational concept, and then you talk about the existing literature, and then you begin with what you are trying to do with your research article. So the objectives of your review and why do you want to do this review. So if an other review exists in this particular field or in the area that you're trying to conduct the review, so how is your review different from the previous review, and what new are you bringing to the scientific community should be stated in your review article. For example, let's take this drug-induced pancreatitis, a critical review, where it was published in 1980s. So there they were trying to establish the case reports and trying to find out if there was a causal relationship for the 25 drugs that they were reported in that particular point of time. And then we come to the new review article that was written, that is drug-induced acute pancreatitis, where they know that drugs can cause acute pancreatitis, and the purpose of this review is to understand the epidemiology, pathogenesis, diagnosis, and presentation. And it also wants to classify and provide us all the drugs that are associated strongly with drug-induced pancreatitis based on the case reports and the laboratory investigations. So when we want to contribute to the new literature, we should uh, we should identify the purpose of a review. We should not conduct the same review again and again when a review exists. So we have to contribute something new by identifying the gaps in the previous literature or in the previous reviews that were conducted. So it brings us to the writing the methods. So what is methods? So methods is how you have conducted the review. You should be able to explain the key search strategies that I've used, the databases that you have screened, and the languages that you have screened. Some literature reviews, they include only English, some can go with Japanese, Korean, and all the other languages they can include. So your method should explain how you have conducted the review, and it should also provide uh, as the inclusion and exclusion criteria, which type of review articles were included or which type of research articles were included in conducting this review. So let's just look at this example of the same paper, that is drug-induced acute pancreatitis, where their methods were to identify the different mechanisms and the treatment and the differential diagnosis of drug-induced pancreatitis. And then comes the results. When we are writing results, we have to summarize utilizing the summary tables, because in narrative reviews, when we are writing results, there can be multiple studies. So we have to not miss out on one study, and we have to explain how each study has contributed conceptually with to the literature. So utilizing a literature summary table will help us to frame research article reviews results in a very simple manner. So we can provide us the information on methods, strengths, limitations, and all of this in a table. So methods of how the research article uh, has done their research, what type of study design have they used, what are the demographic details of the patient population that they have included, and all of these, where was the research conducted, in which part of the world. So all of this should be put in the review research table in our results part. So this was the drug-induced pancreatitis drugs that they have put in the research result table. So let's just go with some other examples to understand the formats of how they have utilized on writing the review article. So here the first review article, the narrative review on adverse drug reactions reporting, current practices and challenges. They utilize the format of introduction, topics, and conclusion. And let's just come to another narrative review where this are talking about clinical decision support for inpatient clinical pharmacist. So they have formats of background, methods, results, discussion, and conclusion. And another review where they talk about liposomal amphotericin B. They have their format as introduction, pharmacology, PKPD, toxicity, clinical experience, and future direction. So now that you have understood that for each review article, there is no hardcore rule of what format you should follow. They can follow any format that they have, that they want, because narrative reviews don't specifically have a hard and core rules. And then we'll come to the discussion part, where you have to interpret the results and provide your expert opinion, synthesize from the existing literature. In case there is a lack of evidence in the existing literature to draw conclusions, you can put that there is lack of evidence. The literature, the limitations, the biases, and the gaps should also be discussed. The potential impacts of results for future results and the clinical practice should also be discussed in this part of our review article. And then this brings us to the conclusion of the review article. So the conclusion should provide latest strategies of how we should progress in that particular area. So for example, we have taken the same pancreatitis review article. So they are mentioning that there is a need to focus on the molecular mechanisms involved behind the drug-induced pancreatitis. So this is how you should write a review article. You should start with identifying the research gaps in the conclusion, and then also providing the how you can do the new research, that is novel ideas and conducting new research. And then comes managing the references. So citations, what the type of citations you choose will depend upon the journal. So once you choose the journal, you have to choose the appropriate citation style. And also the softwares. You can use the softwares like Zotero, Mendeley, EndNote, and all of these. They will save a lot of time so that you can do the bibliography at the end. And also keeping records of the sources will also help you to not miss on any other data. You can also organize these research articles in different folders like in Zotero. And also you copy paste those DOIs. They are very important. Using these DOIs will directly transfer you to the appropriate research articles. And before you submit, you have to review and edit the references. And it is very important that you don't forget the figures. So the figures have to be relevant and they should balance out the total review article, and they should decrease the content complexity. Wherever you feel that the content is complex, to simplify and visually present your data, you can use figures. Let's just take this example of antibiotic utilization in acute pancreatitis. So here they are trying to explain how gut translocation in acute pancreatitis will cause severe sepsis in different patients. So, and also we should try to use the AI tools that are available to us. Like in writing, you can use Grammarly, you can use Paperpal, and then obviously I have mentioned to use Zotero to cite your references. And also to find the journal, you can use journal finders like from the Elsewhere, the Springer, and the Wiley. This will help you to find the appropriate journal for that is cater to your objectives. And the final thing is to finding a suitable journal and then publishing. How do you find your suitable journal? So the scope and the audience is the most important thing. Ensure that your scope matches your review article. That is when you're conducting a review or a research in a clinical pharmacy or a clinical pharmacotherapy thing, you cannot go and publish it in a journal of critical care or something. So your scope and your journal should match. And also the impact factor is very important. The higher the impact factor, the better the reputation of the journal. And also you should think about the site score. And then you should also think about open access versus subscription of the journal. Whereas in open access, you have to pay the publication fees. It says it's subscription, but with subscription you will have to pay no cost, but it is limited to very few audience. And the review process and timeline is also very important. So some journals will take very long time. So if you want to publish quickly, you have to choose a journal that will publish your research in a short time. So timeline is something that you should consider before you choose your journal. And final thing is to identify and utilize this Sandra checklist. So the Sandra checklist, as the Prisma guidelines are existing for systematic reviews, we have Sandra checklist for the narrative reviews. So this checklist will help you identify, and when you write your review article, it will help you score your review article based on the following questions. That is justification of the article important for the readership. And also if your statement of concrete aims, or you have formulated your questions better. If the aims and questions are not formulated well, then your score will be 0. If the aims are formulated but not concretely present, then your question the score will be 2. And if they are concrete aims, then your score will be 2. And also the description of literature search. When the search strategy is not presented, then your score will be 0. So you have to have an appropriate search strategy to have a good score and to be accepted by different journals. And also referencing. Referencing is very important. Key statements must always be cited. And scientific reasoning. Without appropriate evidence, you cannot write your discussion. You should critically appraise and then you have to present your literature. An appropriate presentation of the data, relevant outcomes are has to be presented appropriately, then only the journals will accept your review articles. And the last slide is to most of the clinical pharmacy students and the interns who are doing internship in various hospitals. Other than conducting medication chart reviews, you should try to do review articles which will help you in academics and teaching opportunities, contribute to patient care, and also network and collaborate. Just to reiterate, a review article isn't about discovering, but about synthesizing, summarizing, and identifying the research gaps. Writing a review article signals that you are aware of what is happening in your field or where the field is headed, and that you are interested in patient care. So, if I hope that this session will help you on how you can write a review article. And thank you. If you have any questions, you can mail us at fcpaofficial@gmail.com.
Thank you so much, Amartya, for such a wonderful session. So you have explained how we can write a review article. So you have also introduced us to the review article family also. You have explained about the each and every step in writing the review article by good examples. So I think all the participants will be able to understand and they can go on with writing a review article, starting steps and all. Um, so from personally my side, I have one query. Can you share some tips so that we can ensure that there is a flow in what you are writing? When we are writing the review articles and all, there might be like sections, different paragraphs and all, which is not in a continuous flow. So can you share some tips to overcome that so that the writing does not appear fragmented?
Yeah. So writing cohesively is very important. First, you should begin with writing the subheadings. Then you will understand what to fill and where to write. First, you should start with writing the framework. Then you will try to fill it. That is how you should begin writing. And also, when there is support that you require or when you are stuck, you should collaborate with other researchers, because when you're writing a review, it is not about just writing the opinion or something like that. It is about utilizing the existing evidence and synthesizing the key findings from them. So collaborating and then beginning with writing a framework, doing an appropriate review, and then trying to do statistics wherever necessary, that will help you to write it smoothly. So I would just start by saying that first you hypothesize and then you start begin with the write a framework, and then you can slowly build upon it.
Okay, thank you so much, Amartya. I think this will be a useful tip for all because for every work we need to start with the basics, subheadings and all. Then only you can go forward with the writing. You can fill up the contents and all. You can add the research data and all along with that. But basically, you need a outline for the same. So thank you for sharing for this wonderful tip. And thank you so much, Amartya. I would like to thank FCPI also for giving us such an opportunity to share our knowledge to all. So thank you everyone.